The first time I ever saw a child die, and this story really defines it all for me. This mom had brought her child in, having walked 8 hours from her village in the rainforest, small little girl this big. And I put my stethoscope on her chest. It sounded like car engines choking, and we're desperate to look for oxygen. They had one oxygen tank for mothers who came in for C-sections. About 2 o'clock in the morning, one of the nurses came running to my door and said, "Doc, will you come?" Little girl's oxygen tank was taken back because another mom had come in that night, needed a C-section, needed oxygen, and on the other end, our little baby girl died. That just wasn't acceptable. That no one should die because they live too far from healthcare, that where you were born should not determine how long you survive. That's what pushed us. We wanted to change the idea that illness is universal and access to care is not. Remote communities is one of global health's and the world's largest blind spots. But it turns out, if we look at the data, that these are the hotspots of disease, or the hotspots of death. The tyranny of distance is what we talk about, that if you're too far away, you're the last to receive health services, but you're the one that often needs it the most. But until we can reckon with our blind spots, with the bias against those communities, disease anywhere is a threat to people everywhere. And if we don't get access to healthcare for everyone, that puts us all at risks, whether you're in the rainforest of Liberia, the mountains of Afghanistan, or the cities of London, New York, and San Francisco. What keeps me going is the idea of inclusion. It's the idea that we all matter, and we matter equally. If we can't provide care for the 7-day-old, the first patient I ever lost in rural Liberia, to a level that's equal to the kind of care my children get, then we haven't done enough. That's what keeps me going.